welcome to Lifestyle with Anita. On today's video, we'll be talking about a health-related challenge peculiar to pregnant women. I'm not alone in the studio today. I have someone that's here with me. She is a health personnel. Please, can you introduce yourself?
Thank you, Anita. My name is Mrs. Pamela. I am a registered dietitian. Thank you.
Okay. Nice having you in the studio. Can you introduce the topic for us and explain the topic?
Okay, our topic for today is what? Pre-eclampsia and eclampsia. Pre-eclampsia is actually a condition that is peculiar to women, pregnant women to be precise. It has to do with the increase in one's blood pressure. It occurs between 20 weeks of gestational period. Either your blood pressure is high, or there is protein in your urine, or you have swelling on your feet or anywhere around your body. Thank you.
What are the signs and what are the symptoms to show that the person has these challenges?
It has to do with what? High blood pressure. When your blood pressure is high, when you have blood vision, when you have nausea, proteinuria, protein in the urine.
When we were chatting earlier, you told me that you experienced pre-eclampsia at a point during your pregnancy. Can you share that with us?
Okay, thank you very much. Yes, I actually experienced pre-eclampsia during my pregnancy days. That was why I felt it is very important to share it with people so that they will be aware of it. At about 32 weeks of my gestational period, I got to the hospital and the nurse checked my vitals. When they checked my vitals, I've never had high blood pressure before. So they checked mine was 150/80 and it was actually high. So the nurse told me that my BP was high, which I saw with my two eyes. Then I went to the doctor was like, "Madam, it's a normal thing. Being a pregnant woman, we are meant to have a high BP." I was like, wow, please can you place me on a medication that will help reduce it, which he did. He gave me a particular medication that I was taking. As a typical Nigerian that I am, when I got home, I took the medication for some time, and when I checked the BP again, thought it had reduced. I used my hand, as many persons would do, to reduce the dosage of my medicine. Then later, on a fateful day, I didn't feel any sign. There was actually no sign because BP comes with no. It doesn't come with a particular sign at all. It can just give you a tiny headache, and if you don't take recognize of that tiny headache, it can predispose to something more. Okay, something more demanding or something very deadly. Okay. I just went to the pharmacy and told them, please can you check my BP, and lo and behold, it was 180/100. Wow. And that was because on my own I reduced my dosage. I'm actually a health worker, yes. But nobody wants to be labeled a BP patient, especially at an early age.
Yes.
I know it's not peculiar to me. Other persons that had the same health challenge did the same thing, So, but I was like, wow, this is serious. So, thank God I have a doctor by my side who is my brother. I called him, and when I told him the reading, he screamed. He was like, "Do you want to go into coma?" I said, "Which one? Do you want to have seizure?" I said, "Which one is seizure again?" He said, "You don't know you can have seizure with such a high BP." So he had to change my drugs, increased the dosage, and changed it entirely. Gave me stronger BP drugs, which I started using. And with that, it helped to curtail the BP, my BP level. It went back to normal. So from time to time, I go to check it because I actually don't have my own electronic BP machine at home. I don't. So I go to check it from the pharmacy, and when I check it, the readings are always good because I still maintain my medication.
Okay, this is really educative because I used to think that for you to have a high BP, it means that you have been overthinking, you have been stressed out. But right now, I realize that I need to constantly check my BP. How do you get to know your blood pressure level, and how do you know if it is high or low?
Okay. For you to know your blood pressure level, you have to go to the nearby pharmacy or the nearby chemist. By chemist, I mean someone that knows how to check it very well, because it's not everybody that knows how to use the speed.
Okay.
Some persons will use it and the figure will tell you will not be the right figure. That is why if you go to some hospitals and after the nurses have checked your vitals, when you tell the doctor will still do it again with their hand. Okay, so you have to be sure that the person knows how to check, use the apparatus to check your BP level. Okay. They can actually use the SFIG or the electronic BP machine, either of them. If you read books, they will tell you 120, but most times when you meet your doctors and your BP is 140, they will tell you you have nothing to worry about. Because in Nigeria, actually the ranges of BP is between 120 for the systolic, which is the upper figure, okay, is between 120 to 140. Okay, in Nigeria, if you have a BP of 140, it's actually not bad. Unless if it exceeds 140, that's when we have danger. Okay, then the diastolic should not exceed 80. Anything above 80, anything above 80, 90, 100 is high. Okay, so if you have a systolic of 140 and a diastolic of 80, it's accurate, it's okay.
Okay, you were specific about Nigeria. Does it mean that in other countries it is lower than what we have in Nigeria, blood pressure level? Is that what you mean?
Yes, apparently, yes, because of the nature of our country. Nigeria is hard, it's climate too, it's not helping matter. Stress, the stress
level is really high.
Stress level is really high in Nigeria. Okay, that's why I was particular about Nigeria.
Okay. What are the ways to treat? Where do you need to go to get treatment?
Okay, please, if you need treatment, if you need to go to your hospital, you need to go to your doctor. It's your doctor that will tell you the best medication for you. You don't need over-the-counter medication. It's your doctor. When you go to the hospital, your doctor will see you. He or she will ask you your history. With your history, they will be able to give you the appropriate medication for you. You don't need to go over the counter and buy any drug by yourself.
What are the preventive measures that can be taken in order to avoid this state or challenge?
Okay, the preventive measures is one, eating right.
Okay.
You have to eat well, you have to eat right. You have to eat a lot of fruits and vegetables. Nigeria is so blessed with a lot of green leafy vegetables. Yes. We have a lot of fruits that we should eat. We should desist from fried foods and confectionaries.
Okay.
We should desist from salts.
Okay.
You should exercise more. If you are fat, you should exercise more. We should rest more.
Okay.
Rest is very important. We should try as much as possible to rest. Okay, you should not be a workaholic that walks around the circle, around the clock. No, we should rest more.
Finally, what are your words of advice?
I'll advise our viewers, firstly, to always check their BP level.
Okay.
We are not used to checking our health in Nigeria, not only pregnant women, everybody. It's advisable you always check your BP level. Secondly, it's advisable you eat well. Try to make your food, homemade foods are far better than whatever we buy on the streets.
Yes.
3, try as much as possible to exercise. Don't be the type that sits all the time. The only time you walk around is maybe you are going home. No, try as much as possible to exercise your body, your muscles, exercise very well. 4, if you're on the high side, if you know you are fat, or if you know you have excess fat on your body, try as much as possible to lose weight. If it's possible for you to lose weight, please do. Then, lastly, we should try to take our vacations seriously.
Okay, that's very important for a Nigerian that is a workaholic. Okay. Thank you so much. It has been informative. It has been educative, and we learned a lot. I hope you've learned from it. Thanks for watching. Please don't forget to like, share, comment, and hit the subscribe button. I need this channel to grow, and I need your support. You need to keep watching, and you also need to subscribe so that it can grow and I can give you more informative and educative videos. See you same channel next time. Bye for now.
Bye.